College of Health Science and Technology. NGURU YOBE State. Department of Public Health. TITTLE, National and International Health Agencies. Course code EVT 311. Past question and answer. Here is the question as follows. 1a. Define the term health agencies. 1b. Enumerate the 6 major objective of health agencies. 2. As an environmental health technician, discuss the role and function of Federal Environmental Protection Agency, FEP. 3. Identify and explain the 7 principles of International Red Cross and Red Crescent. 4. Briefly explain the contribution of USAID in Nigeria. 5. List and explain the 4 goals of World Health Organization, WHO. 6. Systematically, in a tabular form, itemize the contribution of UNICEF toward the success of the 8 components of PHC in Nigeria. Here is the question and answer as follows. Question 1a. Define the term health agencies. Answer. Health agencies are organizations that are established to provide services related to promotion of health and eradication of diseases, especially infectious diseases, and to create conducive atmosphere for the populace all over the world. They are also called donor organizations or agencies that offer technical cooperation to the government in matters related to health. In general, the organization assists in. Question 1b. Enumerate the 6 major objective of health agencies. Answer. 1. Promoting the development of comprehensive health services. 2. Prevention and controlling communicable diseases. 3. Improving environmental conditions. 4. Controlling rapid population growth. 5. Developing manpower in health sector. 6. Planning and implementation of health programs. Question 2. As an environmental health technician, discuss the role and function of Federal Environmental Protection Agency, FEP. Answer. FEPA was then charged with the overall responsibility for environmental management and protection. It is on record that by the establishment of FEPA, Nigeria became the first African country to establish a national institutional mechanism for environmental protection. In the wisdom of the government, FEPA and other relevant departments in other ministries were merged to form the Federal Ministry of Environment in 1999, but without an appropriate enabling law on enforcement issues. This situation created a vacuum in the effective enforcement of environmental laws, standards, and regulations in the country. Question 3. Identify and explain the 7 principles of International Red Cross and Red Crescent. Answer. The principles of the movement are 1. Humanity. The International Red Cross and Red Crescent movements are born out of a desire to bring assistance without discrimination to wound on the battlefield, endeavors alleviate human suffering wherever it may be found. Its purpose is to protect life and health to ensure respect for human being. It promotes mutual understanding, friendship, cooperation, and lasting peace among all people. To impartiality, it makes no discrimination as to nationality, race, and religious belief or political opinion. It endeavors to relieve the suffering of individuals being guided solely by their need and to give priority to urgent cases of distress. 3. Neutrality. To continue enjoying the confidence of all the controversies of a political, racial, religious, or ideological nature. 4. Independence. The movement is independent. They render humanitarian services to the populace without subjecting the national laws to retain their autonomy so that they may always be able to act in accordance with the principles of the movement. 5. Voluntary services. It is a voluntary relief movement not promoted by desire for gain. 6. Unity. There can be only one Red Cross or Red Crescent in any one country. It must carry out its humanitarian work through the territory because it is open to all. 7. Universality. The International Red Cross and Red Crescent movement in which all national societies have equal status and share equal responsibilities and duties in helping each other worldwide. Question 4. Briefly explain the contribution of USAID in Nigeria. Answer. In Nigeria, it collaborates with NACA and other health agencies through its programs for combating childhood communicable diseases, assist in expanded programs on immunization, control of diarrheal diseases, malaria control, health communication, training for health personnel for information systems, and health planning. The United Nations agencies, other governments and non-governmental organizations are doing a lot in implementing the various elements of primary health care. The United Nations Fund for Population Activities, UNFPA, is supporting the strengthening of maternal and child health care services, including the provision of family planning services. The Christian voluntary agencies for health under the umbrella of Christian Health Association are providing support for primary health care at various levels and in capacities. The Ford Foundation is supporting the activities of the universities, providing technical collaboration in the health and financial assistance in operational research issues in primary health care. The USAID, through its programs for combating childhood communicable diseases, assists in expanded program on immunization, control of diarrheal diseases, malaria control, health communication, training for health information systems, and health planning. Other service clubs like Rotary International, Inner Wheel, Lioness, Soar Optimists, Zonta, Red Cross, Boy Scouts, Girls Guided, Boys and Girls Brigades are ways to promote the principle of health. Question 5. List and explain the 4 goals of World Health Organization, WHO. Answer. WHO renders services to achieve its goals in these areas. 1. Strengthening of health services. 2. Technical services. 3. Special programs. 4. Technical information. 1. Strengthening of health services. WHO cooperates with member states in the strengthening and reorientation of their health services with particular reference to primary health care (PHC) services, which stated that resources for essential health care can be accessible to everyone. The member nations should reinforce their health system by building of infrastructures and essential drugs and other supplies and equipments. To technical services, under this, the WHO provides technical services on major communicable and non-communicable diseases, tropical diseases, malaria, diarrheal diseases, acute respiratory diseases, childhood illnesses, HIV, AIDS, sexual transmitted diseases, new and re-emerging infectious diseases, heart diseases, as well as mental health. 3. Special program. They have been organized to promote action in some high-priority areas. These include Human Reproduction Program (HRP), Tropical Disease Research (TDR), Integrated Management of Childhood Infections (IMCI), Global Program for Vaccination (GPV), Expanded Program on Immunization (EPI), Special Program on AIDS (SPA), Rollback Malaria (RBM), Stop TB Initiative. For technical information, the organization publishes a number of technical documents including technical report series, summarizing views of expert communities and other scientific groups on specific subjects. World Health Bulletin publishes scientific papers, either original articles or scientific reviews. World Health Reports, annually publication usually focusing on a specific issues or problem, e.g. mental health. Weekly Epidemiological Report, this contains epidemiology information about the occurrence of communicable diseases. Question 6a. In a tabular form, itemize the contribution of UNICEF toward the success of the 8 components of PHC in Nigeria. Answer. Since 1978, when the World Health Organization declared PHC as a key to achieving health for all by the year 2000, UNICEF has actively contributed towards the success of the 8 components of PHC. In Nigeria, UNICEF contributions in PHC are as follows.